walk in, I'm going to introduce myself to my patient, I'm going to verify my order, I'm going to verify my hospital policy, I'm going to perform hand hygiene, then identify my patient with two identifiers, Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. Then I'm going to assess allergies. I see that he has a penicillin allergy, and then I'm going to ask if there's any other allergies that are unlisted that we need to know about. Then I'm going to explain the procedure and provide as much privacy as possible, and then gather up all of my equipment, which I have here, and then I'm going to don my goggles. Next, I'm going to raise the bed, lower the side rail. I'm going to perform hand hygiene and then assess for vital signs, and then with the pulse oximetry, I'm going to assess oxygen saturation. And with my stethoscope, I'm going to auscultate bowel sounds. And so if at any point during this procedure, their vital signs become unstable or their oxygen saturation drops, we're going to stop the procedure and wait for stability to return. Next, we are going to raise the head of the bed to high Fowler's, unless contraindicated, and in this case it's not. And then we're going to establish safety cues with the patient, just in case they need to stop the procedure for whatever reason. Then we're going to open up our NG tube kit, add a dollop of water-soluble lubricant, and then prepare our tape. So the first one that we're going to do is a dog-eared style, and that's going to be to mark the depth on the NG tube that we're going to be going to. Then we're going to be create the tape that we're going to be using to float the NG tube, and we're going to do that like this. And so then we're going to fold the sides over one another, and then like so. And so it should come out looking like that. And then we're going to pull up two more pieces of tape, one to temporarily secure the NG tube after it's been placed, and then one to for the date and time that the NG tube was placed. After that, we are going to open up our 60 milliliter syringe. We're going to loosen the plunger by moving it up and down. And then we are going to, after that, we are going to don our clean gloves and assess for nasal patency. The reason we're doing this is to figure out which nares we're going to be going into for with the nasogastric tube. And so we're going to do this by asking the patient to occlude one nostril at a time and then breathe normally. Also during this step, we're going to be using an alcohol prep to clean the bridge of the nose, and then we're going to pat dry with a gauze. And then we are going to, this is where we would actually measure out the nasogastric tube from the nose to the ear to the xiphoid process. And this is where we would actually use our first piece of tape, the dog-eared piece of tape. And since I'm going to be doing that in a separate video, I'm going to go ahead and just mark 35 centimeters on the tube, and because that is the depth that we are going to be going for this procedure. Okay, and so now that that has been placed and we've got our verified depth, because we measured the patient, we're going to place a towel just in case anything happens and we need to keep the patient clean. We will do that. And then I'm also going to place this basin here. The next part, I'm going to place the end of this, or one end of the Salem sump into the basin, and then I'm going to lubricate the other end with my dominant hand. and then insert the nasogastric tube gently with the patient's head tilted backwards. And we're going to go at a downward kind of angle until we reach the nasopharynx. Once we're at the nasopharynx, we're going to ask the patient to bend their head forward and then begin taking either dry swallowing or taking sips of water. And we're also going to be moving the nasogastric tube in 1 to 2 inches at a time, and also rotating it 180 degrees. So that'll look like this. Like so. And then now we are at our preferred distance. We're going to hold that there and remove our tape. Now we're going to secure it with our temporary tape on the patient's cheek here. And so now with that secured, we're going to verify placement with our tongue blade and pen light. And so all we're doing is checking to see if we can see it in the back of their throat. And then in the same step, we are going to be attaching, if at any point during that procedure, their oxygen levels fall below the, or just start to drop, or their vital signs do become unstable, we are going to stop the procedure and back it up to their nasopharynx, the posterior nasopharynx, and wait for normal breathing to return. And then we're going to also tell them to swallow before we begin. Now what I was saying was I'm going to attach my 60 milliliter syringe by doing that, and then aspirating stomach contents, assessing pH, and then if ordered, we're going to verify placement with a chest x-ray. Okay, and so we've done that. We're going to recap and place back into the basin. Put this over here and this to the side. Now we are going to attach our actual floating nasal cannula piece, or nasal cannula, NG tube piece. And so we're going to remove the first piece of tape, or the temporary tape, like that. And then with our floating piece, we are going to attach to the bridge of the nose and the tube. And so now this will give the appearance that it is actually floating and causes kind of like less friction. Okay, so now that that's attached, we are going to secure the rest of the tubing to the patient gown by clipping it and leaving enough room for them to turn their heads. And then we are also going to mark with an indelible marker onto the tube, just in case the tube gets displaced and they have something to reference. After that, we're going to be demonstrating the proper port to connect the suction tubing to, and that is this port on the Salem sump. You would connect it right there and then set suction to low intermittent wall suction. And then if it's not in use, you're going to recap the Salem sump like that. And then another important detail is while the suction is in use, you're going to keep the blue pigtail above stomach level on the patient. And so we're going to kind of try and simulate that by doing leaving it like that. Now after this, we're going to lower the bed, raise the side rail. We're going to assess the patient for comfort. We're going to make sure that the call light is nearby. We're going to make sure that the head of the bed is 30 degrees. And then, and next we're going to clean up our materials, get everything out of the way, move the towels. And then, and then we will be placing this piece of tape here before we're done to verify the time and date the nasogastric tube was placed. So now with everything put up, we're going to remove our gloves and perform hand hygiene, and then move to documentation. For documentation, we're going to be documenting the NG tube type and size. Then we're also going to be documenting the time, the location, how it was placed, and how it was verified, how placement was verified. Then we're going to talk about how, or document how the patient handled the procedure, as well as the color, amount, and characteristics of secretions. And so now, we're going to be demonstrating discontinuance of an NG tube. And so the first thing we're going to do is verify our order. And we verified it. We're going to perform hand hygiene, and we're going to explain the procedure to the patient. And then we're going to don our clean gloves. And then, so once our glove is finally on, we are going to auscultate for bowel sounds. And so it's never an easy process. Okay, so now with our gloves on, we are going to auscultate for bowel sounds. And sounds good. All right, and then we are going to be discontinuing any suctioning if that's going on, and then we're going to be removing any tape from the patient that's securing the NG tube. And okay. And so now we're going to place the towel like so. And then now we are going to demonstrate kinking the tubing like so. And then now we are going to remove the tubing slowly and gently and smoothly. Now we're going to get rid of that and then discard it. Now we're going to, we'd be measuring the drainage. We will also be performing hand hygiene as well as documentation. And so now I'm going to take off, and then now I'm going to take off my gloves and move to the enema. And so the first thing that we're going to be doing is we're going to gather up all of our equipment. And then, we're going to gather up all of our equipment and then don our clean, or perform hand hygiene, don our clean gloves. Okay, and so can't get my gloves on, obviously. Okay, so my gloves are on now, and we are going to move to the sink now. And so the first thing we're going to do before moving is cap the okay, and then we are going to fill up the enema bag without having to touch the tubing to the sink. And so we're going to fill it up 750 to 1,000 milliliters of water. that. And then so now from here, we are going to add soap. We would add soap and then agitate the water. And then we're going to prime the tubing, like so. And there we go, tubing primed. There we go. And so, yep, and now we are going to lay this on a flat surface and then leave it there. Okay, and so now that that is in place, we are going to raise the head of the bed, or raise the bed, lower the side rail, and assist the patient into left lateral sims. I'm also going to place a waterproof drape here. And so with that in place, we are now going to pick up the tubing and lubricate the tubing. Well, I'm going to pick it up with my dominant hand and then lubricate with my non-dominant hand, and like so. And then with my non-dominant hand, I'm going to place that on the patient's hip gently but firmly. And then I'm going to instruct them to take a few deep breaths, or just take deep breaths during the procedure. Then with my non-dominant hand, I'm going to spread the buttocks and then insert the tubing 3 to 4 inches. Once this has been inserted, I am going to unclamp and, I'm going to unclamp and then raise the bag 12 to 18 inches. I'm going to lower the bag or clamp the bag if the patient ever experiences any cramping or uncomfortability during the procedure. And so, so once that the enema bag has been emptied, I'm going to remove the enema and dispose of that. Yep. And then I'm going to dispose of that. Then I'm going to encourage the patient to hold the enema for 10 to 15 minutes, and then afterwards I'm going to remove this, and I'm going to assist them to the bedpan. Now on the bedpan, you would place their buttocks here, and then this part would be under their thighs. And then so we would assist them to the bedpan, and then where they would void all of their the enema. And then after they had done this, I'm going to take that and dump it into the bathroom, and then remove my gloves and perform hand hygiene. And then when I leave, I'm going to document the enema type, the enema type and amount. I'm going to document the time. I'm going to document how the patient handled the procedure, how the color and amount of return from the enema, and then how the patient was left.